We'll be covering the acromioclavicular joint, or AC for short. The AC articulation is a joint of the shoulder girdle, which is made up of the scapula, our shoulder blade, and our clavicle, or our collarbone. The AC joint is located at the top of the shoulder and involves the joining of the clavicle and the scapula, and allows the clavicle to transmit forces acting on the upper limb to the sternum and the axial skeleton. Specifically, the AC joint involves the lateral, flatter end of the clavicle, which meets with the acromion process of the scapula. The acromion process is a large posterior projection arising from the spine of the scapula, not to be confused with the more anterior coracoid process of the scapula. The AC joint is classified as a true diarthrodial joint, meaning that it is movable, and it is a synovial joint, meaning that it's surrounded by a joint capsule and is lined internally with a synovial membrane, which secretes synovial fluid into the joint cavity. The AC joint is characterized as a pseudoplanar joint. Now what this means is that because the AC joint's articulating surfaces are flat, it is considered a planar joint due to its limited motion under normal conditions of allowing only gliding movement. However, the AC joint is actually characterized as having 3 degrees of freedom, which we know, which as we know, a planar joint has 0. How this is possible is due to its attaching the scapula to the thorax, which allows for additional range of motion to the scapula and assists in arm motion through allowing anterior and posterior movement, rotating and tilting of the acromion during various arm motions. Now Maddie will further describe the motions of the AC joint more in depth.
The acromioclavicular joint has 3 degrees of freedom, which means that it produces motion in the 3 cardinal planes. As Nicole said earlier, the acromioclavicular joint consists of the acromial end of the clavicle and the acromion process of the scapula. Movement at this joint is described by motion of the scapula in relation to the clavicle. This motion then produces changes at the sternoclavicular joint, which work together to produce movement at the scapulothoracic joint. So the transverse plane divides the body into superior and inferior parts. Internal and external rotation at the AC joint occurs in the transverse plane about the vertical axis. This axis runs parallel to the medial border of the scapula. During external rotation, the medial border of the scapula is removed from the rib cage, which gives a winging appearance. During internal rotation, the medial border of the scapula is moved anteriorly towards the rib cage. This movement occurs when you reach across your body. The frontal plane divides the body into anterior and posterior parts. Upward and downward rotation at the AC joint occurs in the frontal plane along the anterior-posterior axis. This axis runs directly through the center of the scapula. During upward rotation, the inferior angle of the scapula moves laterally and superiorly. During downward rotation, the inferior angle of the scapula moves medially and inferiorly. This motion occurs during a jumping jack. The final motion at the AC joint occurs in the sagittal plane. The sagittal plane divides the body into right and left halves. Anterior and posterior tipping at the AC joint occurs at the medial lateral border. This axis runs horizontally across the superior part of the scapula. During anterior tipping, the superior angle of the scapula tilts forward, whereas during posterior tipping, the superior angle of the scapula tilts backwards. This motion occurs when you reach for and grab a door and pull it back open.
I will now be using the complete anatomy application to provide a different way of visualizing the acromioclavicular joint. As Maddie already mentioned, the acromioclavicular joint relies on ligaments to provide extra support. So if we're looking at it right here, we can see that these are the ligaments that we're going to be looking at. So the 3 ligaments that do this are going to be the acromioclavicular ligament, which is right here, the coracoacromial ligament, which is right here, the trapezoid ligament, which is right here, and then the conoid ligament, which is right here. So I'm going to first start by discussing the acromioclavicular ligament. So that's this one here. So I'm going to isolate it so that we can kind of see it a little bit better. So the function of the acromioclavicular ligament is to provide stability and to prevent the clavicle from moving up and over the acromion process. Furthermore, as you can see, it also covers the joint capsule and provides protection. So next, we're going to move on to the coracoacromial ligament, which is right here. And again, I'm going to isolate it again. So looking at the ligament right here, we might look and see how it might be different than other ligaments that we've seen in the past. So unlike other ligaments, so many other ligaments that connect two different bones together, the coracoacromion ligament is connecting two parts of the scapula. So we have the acromion process and the coracoid process. The coracoacromial ligament and the acromion form the coracoacromial arch. The purpose of the ligament is to prevent upward dislocation of the glenohumeral joint, which is in this region again. All right, so now we're going to discuss the coracoclavicular ligament. So the coracoclavicular ligament is actually composed of two smaller ligaments. So that's the trapezoid ligament and the conoid ligament right here. So an easy way for you to remember the difference between the two of them is looking at where the ligaments insert into the clavicle. So the conoid ligament inserts into the conoid tubercle of the clavicle, and the trapezoid ligament inserts into the trapezoid line of the clavicle. These two ligaments form kind of like a bridge, as you can see, that provides horizontal stability for the joint.
The acromioclavicular joint is involved in 40% of shoulder injuries. Given the anatomy and limited covering of soft tissue, the AC joint is susceptible to injury. The small oval articular surface at the lateral end of the clavicle articulates with a similar aspect on the anterior part of the medial surface of the acromion. The articular surface of the clavicle has the inclination to override the acromion due to the inferior medial slope of the joint line. So what I mean by that is the lateral end of the clavicle would override the acromion on the scapula. The AC joint is then prone to injury by subluxation or dislocation when much force is applied to the tip of the shoulder or directly to the acromioclavicular joint. Injury of the acromioclavicular joint is most common in American football and ice hockey, whereas in the UK, this injury is most common in rugby football.